Welcome to Savita Lecture Cast series. Topic for today's discussion is space infections. In this series, we learn about masticator spaces. The masticator space is divided into three spaces: submasseteric space, pterygoid component space, and temporal component space. The submasseteric space is the space between the lateral aspect of the ramus and the medial aspect of the masseteric muscle with zygomatic arch superiorly. Submasseteric space communicates with the superficial and deep masticator spaces. Through the lateral pterygoid muscle, it communicates with the infratemporal space. Through the sigmoid notch, it communicates with the pterygomandibular space. Through the deep surface of zygomatic arch, it communicates to the superficial temporal space. Contents of the space is masseteric artery and vein. Hallmark sign of this space infection is trismus with a mild angle swelling and deep-seated throbbing pain. Management intraorally is done with a vertical incision on the external oblique line and drainage of pus. Extraorally, an incision beneath the angle of the mandible and blunt dissection through the masseter muscle fibers is performed. Pterygoid component space or the pterygomandibular space is very important because it is encroached every day by a dentist for inferior alveolar nerve block and other block purposes. The boundaries of the spaces are mainly medially the medial pterygoid muscle and laterally the ascending ramus of mandible, and hence the name pterygomandibular space. It communicates the infratemporal space through the lateral pterygoid muscle and to the lateral pharyngeal space through the buccinator, medial pterygoid and superior constrictor muscle. Contents of the space includes inferior alveolar artery and vein, mandibular division of the trigeminal nerve. Clinical feature is trismus and a deep-seated pain. Management is through a scissus incision along the pterygomandibular raphe and drainage of pus. The temporal component of masticator space comprises of superficial temporal space, deep temporal space and infratemporal space. The superficial temporal space basically involves the space between the temporalis muscle and the temporalis fascia. It is bounded medially by the lateral surface of the temporalis muscle and laterally by the temporalis fascia and inferiorly by the zygomatic arch. The deep temporal space, on the other hand, is bounded by the medial surface of the temporalis muscle laterally and the skull base medially and the lateral pterygoid muscle inferiorly. The temporal spaces communicate with the submasseteric space through the connective tissue medial to the zygomatic arch. The deep temporal space communicates to the infratemporal space through the posterior surface of maxilla. The hallmark clinical sign of temporal space infection is a dumbbell-shaped swelling close to the lateral wall of the orbit. The contents of the superficial temporal space is temporal fat pad and the temporal branch of facial nerve. Contents of the deep temporal space includes mandibular division of the trigeminal nerve, inferior maxillary artery and vein, and the pterygoid plexus. Management of the temporal space infections can be done intraorally through incision on the mid-ramus level or extraorally through incision similar to the Gillies approach. Infratemporal space is a part of the deep temporal space which lies inferior to the infratemporal crest. It is bounded anteriorly by the maxillary tuberosity, inferiorly by the lateral pterygoid muscle, and laterally by the temporalis tendon. Contents of the infratemporal space includes pterygoid plexus, internal maxillary artery and vein, mandibular division of the trigeminal nerve. Clinical feature includes marked trismus, proptost and closed eye, swelling in the face in front of the ear over the TMJ and behind the zygomatic process. The buccal space through the medial side of the ramus communicates inferiorly to the pterygomandibular space, which in turn through the lateral pterygoid muscle communicates to the infratemporal space. Similarly, the buccal space through the transverse facial vein reaches the pterygoid plexus in the infratemporal space, which in turn through the emissary veins can reach intracranially into the cavernous sinus. The management of the infratemporal space is extensive and involves similar to that of the deep temporal space. Thank you.